André from the Mental Health. I'm here with Dickon Bevington. Do you want to introduce yourself for people?
I'm Dickon Bevington. I'm a child and adolescent psychiatrist. I'm been worked in the NHS for 30 years. I work with young people with multiple intersecting difficulties and needs. The headline is that they're using drugs and alcohol in harmful ways, but that's normally the tip of the iceberg. And for them, sometimes that's the only thing in their life that's sort of working. They've got a lot of trauma, a lot of exploitation, and many of them are on trajectories that might well end up with somebody at some point describing their difficulties as a personality disorder. I'm also medical director at a charity called Anna Freud, which is where I was lucky enough to work with a group of people and found an approach to trying to help people with multiple needs, which is called AMBIT.
Yeah, so tell us more about AMBIT. What's that?
Well, it's an acronym that I don't ever like explaining because it's a really boring and long set of words that doesn't say very much. But it stands for Adaptive, Mentalization-Based, Integrative Treatment. Your AMBIT is your sphere of influence. And in the kind of work that I'm thinking about and talking about, it's often rather smaller than the people doing the work wish it was. But mostly it's often very blurry. It's uncertain as to where I can expect to have a bit of influence and where I definitely can't expect to have an influence. And that leads to a lot of uncertainty for people trying to be helpful in this world.
And I guess the population you work with is often detached from society, maybe excluded from school, maybe ended up in the criminal justice system, as you say. So there's something about the kind of social setting, first of all, that I wanted you to expand on and why that approach is important for that group.
AMBIT has been driven more in ways by, at least I hope so, by people using it than by people, if you like, notionally putting it together, because it's been put together out of feedback. Most of the populations where teams who would say that they're influenced by AMBIT are working are prone to being marginalized, to being excluded, to being sometimes offered no help, and sometimes being offered a sort of cacophony of kind of too much help that everybody who joins the kind of the party sort of has probably trained for some years, has a sort of sense of their explanatory framework, the kinds of interventions that they think are helpful, and whose responsibility in this mishmash of different professionals and informal helpers, who should be doing what. So that idea of the explanations, the interventions, and the responsibility in this big kind of half-organized system are often very confusing, and that leads to failures of understanding across the professionals that are at least as fearsome, sometimes it feels, as perhaps these young people have experienced in their own family life, where people have very different ideas about what constitutes good parenting, and they go to war over that, rather than remember that there's a child at the middle of this who might not take kindly to seeing their doctor bad-mouthing their social worker or their teacher bad-mouthing somebody else. Or sometimes they may delight in hearing that because it gives them an out. And so trying to help multiple workers be more thoughtful about what we as a group who are disparate, have different ideas, which is our richness, or what we look like through the eyes of the young people or families or adults that we're trying to be helpful to. Can we, if you like, use our mentalizing imagination to look at our help through the eyes of the people that we're really trying to be helpful towards?
And you had these two really powerful symbols that really stuck with me from the talk. One was the slide with the starlings and the quote from the young man who said, services are like a flock of fucking starlings. It's quite hard to say, actually, isn't it? And the other was the Tower of Babel idea of, representing what we've built in the NHS. So, yeah, I guess my question is, in that context, is it possible to be a mental health professional without being political?
I think hopefully you get a different answer for every mental health professional. From my position, no. I think it's impossible to be apolitical and involved in people whose lives are kind of mashed up by deprivation, by exclusionary policies, by people using differences for something completely outside of the people's needs, but to score political points, gain votes. So that will be my perspective. I hope that there are others, but I think it's completely impossible to be, if you have anything approaching an understanding of the social determinants of mental health, the social determinants are largely themselves influenced, not maybe necessarily fully determined by, but by political decisions about where we put money, where we develop training, where we make space for groups of people. And the groups of people that AMBIT has particularly focused on are people who are often the most marginalized or excluded, often because they don't want to fit into a single box. They don't have a single discrete mental health problem. They have multiple difficulties that intersect with training, access to jobs, housing, physical health, as well as mental health and trauma. And that kind of coming together of everything is a problem for services that are designed to solve little atomized parts of what AMBIT is trying to create. Is mentalizing has got a strong evidence base, not the only evidence base, for people who have mental health problems of a range of things, started in the world of personality disorder. And that work one-on-one with our clients or patients is strongly validated. There's more work to do, more to learn. But what AMBIT is saying is that if mentalizing in that context is helpful, it's at least as important that the professionals doing that work practice a little bit mentalizing of themselves in their position, which is often one of power and needs to be therefore thought about, but between each other and between the different specialties and agencies that do this work. So it's a kind of systemic and an organizational application of mentalizing this fundamental capacity that humans have to try to make sense of one another, to understand and feel themselves to be understood.
I want to just bring you back to the kind of political point and the activism point, and I just want to get your sense of what the priorities are. If I'm a recently qualified mental health nurse or a early career researcher and I'm getting ready for some activism in mental health, should I be focusing on anti-racism or prison reform or child poverty? There's lots of problems out there. What would you say are the urgent ones?
Don't listen to old white men who speak with posh voices.
Yeah.
Might be a good place to start. I have my own ideas, but in a sense, I think that might be the wrong question, because it does presuppose that there's an idea that there's a sort of someone has the authority to tell you where your activism needs to be pointed. You need to connect your activism to your life and to your experience and where your passion is. There was a famous French psychoanalyst, Lacan, and he had this great, I'm not very good at French, but he said, suivre la jouissance, which is a lovely French phrase which means something like follow the juice or the sort of joy, the kind of about life. And you've got to find where your passions are, because trying to work outside of those is probably not where your energies are going to be gathered. So in a sense, there's multiple places where activism can be applied. What you've got to work out is, where have I got that kind of energy? So there's a book coming out by an author that I really admire called Evie Muir. It's called Radical Rest, and it's about burnout in people who get involved in activism and how to avoid that. And I deeply recommend that to anyone who wants a think about that.
Nice answer. Thank you very much. Enjoy the rest of the conference.
Thank you. I will.